And isn't it just fabulous that we've come a long way from the 1970s when I entered medical school, when we talked about cancer victims, and we now talk about cancer survivors. And it is true, there are probably 12 million cancer survivors now in the U.S., and interestingly, about 10 million of them are over the age of 65 if you read if you read the current statistics. So survivorship has improved dramatically since the war on cancer was launched in 1971. It is legitimate for us to talk about cures in some cancers, like testicular cancer, like Hodgkin's disease, childhood leukemias, and we can certainly talk about long periods of disease-free survival in cancers like breast cancer and colorectal cancer and many others. Currently, actually, about 2 out of every 3 people newly diagnosed with cancer, so 2 out of 3 of those 135 patients a day in North Carolina newly diagnosed with cancer can expect to survive at least 5 or more years after the diagnosis. So although we can sometimes get pessimistic about where we are in the war on cancer, there is a lot to actually celebrate in terms of advances and the great numbers of survivors we have.
I am a 17-year survivor of non-Hodgkin's lymphoma, and thank you. I was diagnosed as a young adult, which is always a shock and a surprise when you're 35, seemingly incredibly healthy, and they say you have cancer. And I think that everybody who's a cancer survivor in this room and everybody who delivers this news knows how that brings you up short and changes your life from the day that you're diagnosed.
You don't know what somebody experienced unless you walk in their shoes. And so unless you've had cancer or gone through treatments, you really don't know what someone else is going to experience. But for those that have gone through that experience, I think connecting them is an important therapeutic process in terms of creating communities. We talk about when you get diagnosed with cancer is mobilizing your support communities, be it family or friends, navigators, or community religious church groups. For that new life that somebody has because of cancer, there are others out there going through the very same thing, and I would think you could connect them, that there's some shared commonalities there that would be beneficial.